Hi, I am going to talk to you about a medication called Keppra. This is something we're going to be prescribing. So it is used for seizure prophylaxis as well as like an anti-epileptic drug. Typically the dosing is about 500 milligrams twice a day. It's just an oral pill that you're going to swallow with some water. The problem with this is that it needs to be taken at the same time every day. This is because the medication is very good being absorbed through the mouth, but what happens is that it only can work in the body for about 6 to 8 hours. So after that 6 to 8 hours, it's going to need, your body's going to rely on the medication again. So this is why we have you take it twice a day, same time every day without forgetting a dose. Like I said, we'll start you about the 500 milligram tablet, but there is a chance that we could increase it, but the maximum dose that we would have you take every day would be 3,000 milligrams. So Keppra is used to prevent seizures. Seizures are typically caused by synapse firing in your brain. Your brain kind of sends these neurotransmitter signals that tells the brain kind of what to do. When you have an overabundance of that, your brain kind of goes into like seizure mode. So Keppra is going to work by lowering that nerve firing. It's going to get the synapses to not release that many neurotransmitters. So that way you're not overbearing with the releases, and it kind of lowers how much your brain is sending. It doesn't affect your brain or how it works or how it functions. It just kind of gets it back to a normal level. So Keppra is responsible. It once it gets through the body, it's going to be metabolized and excreted in the urine. So the kidneys are responsible for kind of processing the medication, and then when you go to the bathroom, it comes out in your urine. So if you start experiencing any kind of like kidney problems, sickness, things like that, you just need to let us know so we can kind of take a look at your kidney function to make sure that things aren't getting worse. It's not saying that you have a problem or that anything's going to happen, but those with kidney failure tend to not excrete as well, and so this medication can cause a problem for that. So those with renal failure are at higher risk for an overdose. Some adverse reactions that you may get are going to be things like a rash, fatigue, slurred speech, dizziness, headache, loss of appetite, and mood changes. Mood changes are very common in children, but they can happen in adults as well. So these are all things to kind of monitor. It may take a couple weeks to kind of get used to the medication. If you start to experience any side effects that are concerning to you or anything that I've mentioned, I'd like for you to reach out to the office. But I don't want you to stop taking the medication abruptly. So don't stop it on your own. Make sure you call us first so we can figure out the next game plan. Reason being is if you start stopping the medication, then you don't have that prophylaxis and a seizure is more likely to occur. So like I mentioned, the medication is excreted in your kidneys, or processed in your kidneys, excreted in your urine, lasts for about 6 to 8 hours in your body. That's the time that absorption takes. We went over the adverse reactions. I mentioned the kidney failure and kidney disease. So we may draw some labs today just to get a baseline level of your kidney function, and then probably test some more labs in a couple months or so just to make sure that everything's still working appropriately. But again, like I said, this is something you're going to take twice a day, same time every day. Make sure you're not forgetting the medication. Call us with any concerns. And yeah, so any questions for me?